Let's start with the first question. This may be a bit this is practical, pero but it's a real question. And if the patient is on an ET or an endotracheal tube, wouldn't it be painful or discomfortful if we move the patient for rehab per se, for example?
That's a very good question, Aaron. So I'd like to thank the person who sent that. Usually, we are very, very careful when we try to mobilize the patient in the first place. And we don't usually mobilize the patient if they, specifically, when we try to, for example, set them up, that's the usual time that we usually move the connections with especially in the tracheal tube.
Mm-hmm.
So we usually ask the patients, they are awake, and we need to ask the patients if they are actually experiencing any sort of pain or discomfort. Okay, so we do this before, during, and especially after we do the mobilization. So can it be painful? Yes, it can be a little bit painful, but just as long as you are very careful. Again, you have to take time to really make sure that the anchors of the endotracheal tube or the tracheostomy tube, are safely intact, and before we try to mobilize them. So again, it's very important that we try to mobilize these patients and get the feedback from them, before, during, and after.
Thank you, sir. The next question is very timely because it's related to the pandemic. What are the challenges that have been encountered by the rehab medicine service in delivery of care for ICU patients during this COVID-19 pandemic?
Obviously, unlike some specialties that the prescription is to give the medication. Our medication is to do the exercises, to do mobilization. So yung very, very critical for us is yung close contact. So we have to be in the ICU, in the patient's room. Okay. Secondly, we have to be there for at least 30 minutes. No, especially our physical therapists. That's why we're very, 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 very proud of our physical therapists who actually agree to go into the ICU and treat these patients. We very, very well know that they actually need these types of interventions, and it will really, really help them. Okay, not only during the time that they're in the ICU, but especially afterwards. So, well, that's one. No? That's you have to be there for a long period of time. Secondly, syempre yung pag yung takot din talaga diyan. Initially, we had trouble with yung PPEs initially. Okay, so we didn't actually treat them, but once we had the necessary materials to try and make the environment as safe as possible, not only for the patient but also for our therapists, then we proceeded to with our program of mobilization. So I think yun yung pinaka-importante during this time, the availability of the PPEs and the amount of time and that we have to spend with the patients. I think
As you've been able na, sir, to na kahit COVID positive pa sila, there have been some patients under your service na nakapag-rehab na.
Oh yes. So we actually well, yung mga patients, number one, just like what we emphasized during my lecture, the patient should be stable. Okay? Sa respiratory, neurologically, and sa cardiac. So once they are those parameters are met, then we do actually proceed kahit na positive yung patients. So we've been doing that since last year. So when a lot of people were well, they stopped going to the clinics and they stopped treating patients, we actually continued.
Thank you, sir. The next question is about more or less research na related dun sa question 1. Do we have studies successfully done in the Philippines on early mobilization of mechanically ventilated patients in the ICU? And are there any recommendations that have been established from them?
So far sa mga research na ano ko, wala pa talaga. That's why it's I think very very important kasi malaki pa yung gap eh. There's still a huge gap with regards to knowing the basics of early mobilization. Just like what I talked about earlier, no, maraming gaps in terms of knowledge, and yun lang, especially yung ano yung basis, ano yung just being on the same page in terms of saying what is early and what type of mobilization should we do. Ano, hindi pa natin maano yan. But yan yung problem din natin dito sa Philippines. Yung I'd like to point out yung binanggit ni Dr. Sanchez that that's one thing that's very lacking sa atin dito sa. We're not used to referring patients in the ICU to our specialists na in psychiatry. Wala, it's not a very popular intervention that we usually do. But again, I think studies have shown that it can be very beneficial for our ICU patients and their family.
Very malaki nga yung gap, sir. Sobrang ano. Thank you, sir. This next question is a bit interesting kasi for long-term patients, I think. One participant is asking if can muscle atrophy be reversed, especially to those who have been bedridden for so long, even after hospitalization?
Maibabalik 100%. It's a possibility. Okay, number one, it's a possibility. But the time and effort it will take, especially not only for the patient, but also for the family of the patient, kasi yung support that they will need to provide. Rehabilitation, especially in our setting, is not very popular kasi parang nandyan naman yung mga kasama sa bahay, they can do that, etc. But it's actually the guidance, guiding them to try and progress the program as early as possible and as effectively as possible. And then having to do this for a prolonged period of time. So yung muscle, for example, loss of 10% in muscle mass, that will take at least 6 to 12 weeks of rehabilitation just to develop to try and get it back. So do sa lecture ko, parang 10% in about a week, you can lose it. But you need about 6 to 12 weeks of hard work in order to try and regain that. So pwede naman, but medyo mahirap talaga.
Tiyaga and mahabang oras.
Mahaba talaga.
Actually, there are more questions coming in. Biglang ang dami na ng mga tanong. So I will just... two questions. Actually, the next two questions are related to each other. So pagsabayin ko na lang, sir. Then the next is there any formal training available to equip healthcare providers to perform early mobilization? And then yung next question na I think is related to this is, in the ICU setting, when there are limitations in equipment to proceed with early ambulation, are there sets of nurse-assisted or physician-assisted activities to start early mobilization?
So I think yung very important thing that has to be emphasized is that yung treatment in the ICU obviously is multidisciplinary. So and it doesn't only involve the medical staff. No, the paramedical staff is actually has a very very huge role in terms of preventing a lot of the complications. No, unfortunately, in our setting right now, no, yung number of nurses man lang in the hospital, medyo kapos tayo dyan. We clearly need to have more nurses. Okay. So a lot of them are overworked. No? So kahit na alam namin yung gagawin, alam namin yung pwedeng what are the things that should be done for patients, we can't ask anything extra from them anymore. Just because, for example, in the ICU, instead of handling one patient, sometimes they are handling 3 patients. So which is very, very taxing for them physically.